This is a public health class. Well, introduction to public health. And so we need to talk about public health organizations and how to get together. So there's two main halves of this lecture. There's community organization and planning, and then there is, where was it? Where did it go? Well, anyway, how to organize. So the first half is about organizations that are out there, and the second half is about how to organize. And both will be very brief, very quick, because again, this is not a public health class. This is not actually teaching you to actually do it. I'm just telling you what the steps kind of look like at a very high level in case you ever want to take a full public health class. So the kinds of organizations out there, there are three main divisions, three main ways to look at them. There's governmental, there's non-governmental, and something in between. The real way to tell which one as organization, because the organization specifically can claim to be in one of these or not the other, but to tell which one they really are, you just follow where the money came from, which is true for a lot of things. So if the salaries of the employees, of the staff, came from your taxes, money came from the government, and the government got their money from your taxes, then it's governmental organization. After all, you can do whatever your job requires of you, and you can state like very high ideals, and you can have some very beautiful goals, but you're going to do what you need to do to keep your job and get paid. That's really the bottom line. So if the person giving you the money says do it this way, you're going to do it that way because you want to keep getting their money. So if the money came from government people choosing who to give their money to, then you try to keep those government people happy, and that's government organization. Non-government then does not come from government, but the money then came from something else, and that's private donations. Now, private donations doesn't just mean people responding to GoFundMe. Any private organization. So money could come from corporate interests. If a company selling things gave you money, and you happen to be the public health organization deciding if that thing was healthy or not, guess what? People are going to suspect your reports. If you come right out and say that thing is perfectly healthy, there's no danger, it's even good for you, and then people follow the money and see that the funds that keep your organization alive came from that company that makes the thing, okay, your comments are suspect. There's a potential conflict of interest, but you are still a private organization. Now, if the money came from personal donations, individuals giving you money because they responded to a commercial about all the good things you do for people, and they say, yeah, I want to support that cause, here's $10. Then, okay, so you have a different order. You have a different set of marching orders, and you respond to the people who gave you money for that reason. So that's private organizations. Quasi gets money from both. Private donors, whether they're individuals or philanthropy organizations or for-profit corporations, and the government. So let's talk about an example of each. Well, the government, clearly it's the government organization. So your taxes pay for the federal government, and a part of the federal government is about keeping the American public healthy. The Centers for Medicare, Medicaid Services, Health and Human Services, the Physician General of the United States, these are all government organizations. And for every federal organization, there is a state version because, division of labor, right? And then for every state organization, there's local. No big surprise there. Above the federal, there's international, because your taxes is how the United States makes donations to the United Nations, the World Health Organization, which is part of the United Nations, and other international groups that promote public health. World Health Organization. So the WHO is the part of the United Nations that deals with all health-related matters. They got a bit of a they got some criticism of how the COVID-19 was handled, and so the political debates, people who are against public health efforts like masking, vaccines, social distancing, saw that these recommendations came from the Center for Disease Control, which is the federal level, and the World Health Organization, which is the international level, and say, those guys must be the evil ones because they're the ones saying we should wear masks, to get vaccinated, and social distance. So therefore, these organizations are pure evil. And from now on, anything else they say, I will do the exact opposite. That is the talk from anti-healthcare recommendation social groups. So that's why you hear negative things about them. And some of it is right. Because anytime you organize a group of people, no matter who they are, there will be inefficiencies, there will be mistakes, anytime money flows, there will be corruption. You cannot stop that. That's just what people are. The only way you will stop people from being corrupt is to make them not human. Change their DNA so much that what the end result is not technically a human anymore. And if you were to march into the WHO headquarters and fire them all and replace them with your people who are good, then pretty soon you will see corruption and inefficiencies again. Because anywhere you put people in charge of money, you will get corruption and waste. So that said, on top of that, then the WHO is doing the best they can with what they got inside all of this corruption and inefficiencies. And so is the Center for Disease Control. Okay. So some of the things that they're most well known for before COVID is UNICEF and UNHCR. How many of you heard of UNICEF when you were in school, like grade school? How many of you got that orange box and you fleeced down your parents and your relatives for spare change and cash? Yeah, that's the UNICEF, United Nations Children's Emergency Fund. What's the purpose of those orange boxes? Because what do they make out of that? Like a couple of $1,000,000? That's chump change nowadays. So it's not really the money that they were making you go for. It's that you were bringing, it was advertising. It's a big, giant advertising scheme to make the United Nations in general, UNICEF specifically, but United Nations in general, get under the shield that the adults put up around them. Where as we go through life, we're constantly bombarded by advertising, by promotions, by this organization, by those people, con artists always trying to take our money. So we've put up defenses. We've put up force fields to protect us from intrusive messages. And then your little baby comes home from school with an orange box and says, this is for Children's Emergency Fund, and you give them $20. What that did was it got the message under your defenses. Their child brought the advertisement of UNICEF under these protections, these mental guards that you put up around you. So that's the purpose of those orange boxes. But just because that was a sneaky thing to do, it doesn't mean UNICEF is evil. So they do go around, try to make the world a better place for children suffering in emergencies, from natural disasters, from man-made disasters, trying to prevent or cure pediatric diseases. And unfortunately, with worldwide pediatric medical problems, the most common cause is poverty. In the United States, the most common cause for pediatric diseases is toxins that come from corporate, putting things that made by corporations that we put in our mouths, introduce toxins into our bodies, and then makes us sick. But children in the United States, the rates of malnutrition and other poverty effects are much lower. They're still there, but they're much lower. But outside the U.S., that is it. Poverty is the number one root cause of childhood emergencies, because that leads to malnutrition, dehydration, lack of access to health care, lack of vaccinations for all of these horrible diseases. So UNICEF does great. UNHCR, before COVID, you heard UNHCR every time there's a news report of like refugees. So if there's a war or a natural disaster that displaces people out of their homes and sends them somewhere else looking for relief, and then there's a news reporter there talking about it on 24-hour news, and then somewhere in that report they will say blah 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 UNHCR blah 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 blah, and what's happening is that the people from UNHCR are on the ground doing what they can with what they have. Okay, so that's international. Some of the achievements of the United Nations. So wild polio virus has decreased by 99%. It's only 1% of what it used to be because of vaccinations. But here is the news reports here that in areas where healthcare system is crashed or obliterated, like here, then since the kids could not get the vaccine, polio has become a real threat again. Smallpox was wiped out from the United States. That is a vaccine success story, smallpox. Because when you're born, there is a routine vaccination for smallpox for all newborns here in the United States. And so thanks to routine vaccinations and also improved nutrition and other childhood hospital services, neonate means newborn, so less than 1 month old, from birth to 30 days, the number of deaths after being born declined by 5 million to 2020. And this was a 2020 number, so like half. The number of neonatal deaths reduced by half in 10 years. The list is the last count, so the next count is 2030. Hopefully it'll be better. New HIV infections have been reduced. So HIV is still growing, but the rate of growth has been reduced. That's what new infections means. So there are still new infections, but the rate of them is growing because of increased education, increased more clean needles, so people don't share dirty needles, better education of condom use, so safer sex. And those are the two main ways that AIDS is spread: dirty needles and unsafe sex, like sex without a condom. Okay. So that was international. National, in the United States, the big one, the umbrella corporation for all health in the United States is Department of Health and Human Services, under which we have the Center for Disease Control, Center for Medicare and Medicaid Services, in which case, why is there only one M? If it's Medicare and Medicaid, they have to share an M. The Food and Drug Administration, the National Institutes of Health. So when you see me Google for or search on websites, as long as I see cdc.gov, cms.gov, fda.gov, nih.gov, these are the official statements of the United States healthcare. Those are under the Health and Human Services. There's another organization, the Department of Agriculture. They are in charge of the Environmental Protection Agency, occupational safety hazard. OSHA is your friend. OSHA is your friend. These inspectors make surprise visits to companies and inspect the workplace for safety violations. Your employer wants you to hate OSHA because OSHA inspections shut the business down, hurt profits. Enforcing safety rules hurt profits. But you don't fall for that, because when your employer skips safety rules or cuts corners on safety rules, they make the workplace more dangerous in order to increase their profits. So they're basically saying they want you to suffer more injuries so they can buy another luxury car. That's what they're asking you to do when they ask you to help interfere with an OSHA inspector or hide something from an OSHA inspector. You really want to do that? You want to put your life at risk so your boss can buy another luxury car? So instead, you should help the OSHA inspector. If there is a safety violation that you notice, then don't hide it from them, because it's gonna, it's karma. You help them, you help your boss avoid safety rules, and one day you get hurt, and you have yourself to blame. So OSHA is your friend. Department of Homeland Security, okay, they are not Department of Agriculture. So something happened here. I did not mean to imply that these organizations are under the Department of Agriculture, right? These are all separate organizations. Every one of these, you will have the state version. So the New York State Department of Safety, New York State Department Health and Human Services, and then underneath that is the local, city, local, etc. The textbook lists, for those of you who got it, the textbook lists these functions of your local public health office, which I rearranged functionally in 3 functional groups. So if you're interested, this is a better way to understand it. Okay, so, and then finally local. It was the local health department that told New York City restaurants they can no longer have trans fats in their food. The reason why commercial establishments love trans fats is because it keeps the food juicy and moist and for longer, extends shelf life, it makes it tastier, feels better in your mouth. Customers love it, and it's cheaper. It helps save money. That's why restaurants love it. The reason why it's banned is because it causes heart attacks. Of all the bad fats, the trans fats have been proven most of all to cause heart attacks. And so finally, New York City, the local health department in New York City, put their foot down and ordered it. Now, if you really, really want to have that flavor, then you can go to the supermarket and buy it yourself and add it to your cooking. And you say, I don't care about heart disease, it's all fake news anyway, but trans fats taste great, so I insist. Don't be a nanny state. Don't force me to be healthy. It's my body. I can do what I want. Okay, then go to the grocery store and buy yourself some trans fats. But I'm not going to tell you what they are. I'm not going to help you do that to yourself. Okay, so that was government. Quasi-government means money came from both private donations and government funds. And here are some, like, unlike the National Institute of Health, the National Academy of Science and the National Science Foundation get funding from both. Why would you care, or what does it mean to you? So you who are interested in a public health type of class, and if you move on to like more higher level healthcare classes, eventually you'll get to like senior level classes and then maybe graduate level classes, and then you're going to be doing lots of research. Lots and lots of research. So you'll run into these organizations a lot as you're doing research, like not just plain old Googling, but like professional level library searches. So the NAS and the NSF are organizations you will turn to again and again and again. If you ever watch a documentary, which is a little getting more and more rare as less people have a TV and more people get their news from YouTube or stuff like that. But anyway, if you ever watch a documentary, at the beginning and at the end, there'll be this like statement like, this program made possible in part by donations from the Robert Wood Johnson Foundation, the Bill and Melinda Gates Foundation, the National Science Foundation, and viewers like you. And so that's where the money, some of that money came from to make that show, that documentary about dinosaurs or physics experiments and like that. The American Red Cross is a quasi-government organization. Money from the government and private donations. You may have heard about the American Red Cross in one of two ways. They publish and help with CPR classes. The real information source for CPR, heart health, is the American Heart Association. But the American Red Cross also does its part. And so depending on where you got your CPR class, it could be ARC, like this, or the AHA CPR card. But the other one is every time there was a fire in the New York City, and like a residential, and people lost their house, then the Red Cross volunteers were there to help those victims get back on their feet. Provide some emergency food, emergency clothing, a place to stay, paperwork assistance to reactivate or replace their credit cards, regain access to their bank accounts. So all of this stuff, because these people just lost everything. So the American Red Cross. So the ARC does send volunteers to natural disasters in the country to help American citizens or people, right? So I don't think they're actually particularly concerned about whether the victim is a citizen or not. The American Red Cross didn't invent this concept. That the original Red Cross was from Switzerland. So people in America long ago said, that's a great idea, let's do it in our country. And so yes, there are Red Cross organizations internationally, all over the world. Why the cross? Why a cross? Isn't that like the sign of Christianity? Why the cross? Well, in ancient Europe, the cross, yes, the sign of Christianity, was a recognized symbol in Europe for hope and compassion and helping your fellow human being. So that's why they picked the cross. What if somebody with a big white cross showed up in Israel or the Gaza Strip and said, I'm here to help you? What kind of a reception do you think he'll get? Not a very good one, because in the Middle East, the cross was a symbol of the Crusades, of European invasion into Middle Eastern countries. So the narrative, the stories told through the generations, was not a very positive one for European organizations. And you show up with a symbol of Christianity into the Middle East, you're not going to get much of people are not going to accept you very well. So instead, the Red Cross organizations there have the symbol of the Red Crescent, because crescent is a symbol for Islam. And again, it's about providing hope and charity and compassion to people in suffering. Somewhere in Southeast Asia, that's like a heavily Buddhist population. And oh, by the way, that country is having a civil war against the Muslim half on the other side of the country. What kind of a reception is that person going to get? So again, those organizations are using sometimes something called a crystal, a Red Crystal Society. So somebody stops them and say, wait, which religion do you represent? And the people in the Red Crystal Society is like, look, we're not here trying to push any religion. We're here because people are starving and we brought food. You look thirsty. Do you want a bottle of water? Here, we got a crate of water. You help yourself. Okay, don't worry about us representing a religion. We really don't care. We're just here to help. And that's the Red Cross International organization throughout the world. So, of course, volunteers provide their time and effort and sometimes their lives, but also provide money instead of going themselves. And then governments, of course, say, you do good work, here's a check. Keep doing what you're doing, and that's quasi-government. NGOs, the third kind, are non-governmental, so they absolutely reject any government attempts to provide any funds because they want to keep a very clear break from any association with a government. You show up in a country that doesn't like the United States very much, and you are a quasi-organization with some American tax dollars funding some of your work, then they're going to wonder if you're like a secret agent. Instead of getting cold hard cash from the government, they would rather get a tax cut, a tax deduction. So technically they're not receiving any money from the government, they're just not giving money to the government. So they're getting more money to keep for themselves. And that's the tax status. So non-profit organizations have to meet some very strict tax guidelines in order to qualify for reduced or even be tax-free. What's that organization that sends doctors to different parts of the world to provide charity services, famous for not being affiliated with any country? Doctors Without Borders, right? That's a translation. So their official name is Médecins Sans Frontières, which is French for Doctors Without Borders. So that's one. Voluntary health agencies now. So yeah, that's when the staff work without pay. Donations go completely towards supporting the organization, like buying the supplies, paying for the building, paying for the vehicles. Research organizations being the leaders, so they set themselves up to be the leader of that field. So they need money to help in research, to educate professionals, to provide services, to be an advocate for people in that medical area. And the example is the American Heart Association. So technically they are voluntary, non-profit. The American Cancer Society. If you take a CPR class here at Queensborough, you will get an AHA CPR card, American Heart Association CPR card. Another category of non-governmental organization is a professional health organization. So if these voluntary organizations exist for the benefit of the people suffering from those health problems, professional organizations exist to benefit the members. They are not there to help who those members help, but they are there to help the members itself. And this is a good idea to join your professional organization. So if those of you who wanted to be a nurse after you graduate, it's a good idea to join the American Nursing Association. You go on to medical school, it's good to join the American Medical Association. So you pay dues, you pay for membership, but in return, you are part of this organization that watches out for you. And they have they have meetings and newsletters and discussion forums and all of this to give each other advice and etc. They also then have their money to send lobbyists to Congress. And their job is to keep an eye out for laws that either hurt or help the profession. If law starts working its way up Congress that might make the nurses' lives easier, then those lobbyists will run around, meet all the congressmen, and try to convince them to vote yes. If the law looks like it might be bad for nurses, then the lobbyists run around, try to convince the Congress people to vote no. That's what a lobbyist's job is. So that's how another way they help. Okay, another category is philanthropic organization. Phila means love, anthro means human. So lover of humans. Philanthropic organizations are things that help humankind in general. Bill and Melinda Gates Foundation, you hear from them a lot. Well, I've heard from them a lot. Robert Wood Johnson, Carnegie Mellon Foundation. Does anybody know where Bill Gates got his start? I think most of your generation now just knows him as some guy who throws money around at charities. But before that, he was famous for something else. He made Microsoft. He started Microsoft, the company. Carnegie Mellon is most famous now for that university in Chicago, in the Midwest. Wait, is it Chicago? Carnegie Mellon is a university in the Midwest somewhere, famous for engineering, world-class engineering school. Carnegie Mellon, the human, was part of the oil barons in the industrial America, and he got fabulously rich back before they had workplace safety laws, back before they had laws against monopoly, back before they had laws against a lot of that made illegal a lot of the corporate maneuvering that is now illegal today. And his company did that all the time. And he was fabulously rich, but his reputation as a human being was utter crap. You said the name Carnegie Mellon in those days, and you knew two things: he was rich, and he was a horrible human being. I don't know about him personally, but that the things he had his company do caused so much suffering and damage that people had a very bad feeling about him. And Bill Gates, I don't know if he was a good or bad human being, but Microsoft, right, the reputation of Microsoft, yes, they changed the world, but they have their critics too. So this is what a philanthropic organization is like. Oh, many of them are. A person who got very, very rich through some questionable ethical strategies, bought everything they ever wanted, and they still had too much money left over. So they helped everybody that they felt like helping, and they still had too much money left over. They invested in financially sensible things, and they still had too much money left over. They're that rich. And so at that point, with nothing left to worry about, people start thinking about how they'll be remembered, their reputation, cleaning their name, being praised by as many people as possible. So they start these philanthropic organizations to throw money around for good causes and hope that in a generation or two, people will only remember them for these organizations that stuck around doing only good things. And that's why nobody remembers, nobody who isn't a historian remembers who Carnegie Mellon used to be. They just know that it is a highly prestigious name for engineering and education. It's like Ivy League level. It's so competitive to get into that university, for engineering at least. So this is what happens. They spend their money to clean their name, at least for the next generation. Finally, you have local social religious service organizations. You may be a member, or your parents may be a member, and they chip in, help out, do the things that are needed to be done around the community. Okay, so some definitions now. Community organizing means you gotta get the people and resources together to get things done for good reasons. Grassroots is when the inspiration and the effort to get this happening came from all the people who are there, the community itself. So people gather around the neighborhood and say, damn it, something needs to be done. But they don't, but nobody does anything, and then the idea dies. Well, what if instead of dying, one or two of them start saying, I know what to do, and I got a printer, and somebody else says, I can donate paper, and somebody else says, I got time, I can do the walking. And so they finally start to coalesce around these ideas. And then an organization suddenly sprouts out of the ground, like out of nowhere. That's called grassroots. This is like what everybody wants to claim because it's legit. It's like street credibility. But so sometimes it's faked, like fake grassroots. But anyway, that's great. Gatekeepers are the people who control the resources in the community. That could be religious leaders, business leaders, people who are prominent or famous, who have a lot of say in the neighborhood. So community building means getting all of this together to get it done. You've heard the word coalition a lot, and the idea and the purpose of a coalition, and the point of the coalition is that it's a temporary agreement. It's not an alliance. An alliance is permanent. Coalition is temporary. For convenience. The Yankees fans and the Red Sox fans, their baseball teams, hate each other's guts, but they both love baseball. Like the local baseball field, and how it's the local park baseball field, and how it's been overgrown with weeds. And they both say, we'll take turns to take care of the lawn and make it nice and clean. Okay, that is a coalition. They hate each other's guts, but they both love baseball, and they'll both work together to clean up the local baseball field. So that's a coalition. It's not permanent, though. At any moment, or as soon as that project is over, both groups will go their separate ways. Corporations can sometimes start a charity or healthcare related project. Why would they? I thought they were all about the profit. Well, for two main reasons. They want to look good in front of the public so that the public is more willing to buy their product. And that's why you go to a fair or a park or a event, and there is the corporate tent, some big company name, and they're giving like healthcare screenings, or they're handing out bottles of water. Something good is being done for the community, and then they put their big name in big banners across it to associate their name with good feelings. And then the community is more willing to buy their product or use their services. So that's really an advertising thing. The other effort by corporations is they really do benefit from a healthier employee base. The healthier employees take less sick days, they are more productive, they pay attention longer. So a healthy employee is a productive employee. And it's much better than a sick employee. So they want their employees to stay healthy. So there are corporations that pay for they pay for gym memberships or give a discount for gym memberships. They pay for nutritionists to be available and give incentives for their employees to go on a diet plan. They don't force them to, but they make it easier to. So they find out they first find out what is it that people find most difficult about getting in shape. What can we do to get that obstacle out of the way so our employees do get in shape and then become a healthier, more productive employee? Activism versus advocacy. You hear the two terms all the time whenever you see a report about some kind of community effort. The difference, and they almost mean the same thing, and people often use them the same way, but there's a subtle difference, a subtle grammar difference, which is activism is done by people who are part of that group. Advocacy is done by people who are not part of the group. And the example I always use is still true, AIDS, HIV/AIDS. So if you are HIV positive and you do make efforts to do things for anti-AIDS, HIV projects, reduce the spread, free condoms, clean needles, calling your congressperson and trying to get laws passed, that you are an activist, because you will directly benefit from any results out of this project. Advocacy is you're not HIV positive, but you want to help anyway, so you are an advocate. And if you are a healthcare provider, you go on to become a healthcare provider professional, then many times you will be told to be the patient advocate, meaning your patient, you're not just there to do a job, then get your pay and then go home. You're there to make sure the right thing is done for your patient, whether it's your responsibility or not. So if you see a mistake about to be made, you don't say, it's not my problem, and walk away. You call it out before it's made so that the patient doesn't get harmed. So you are a patient advocate. Empowerment is a word that is used many times in any kind of disadvantaged minority discussion, conversation. So it means that give power to the person who may have had it taken away. And there are 4 levels here: personal, small group, organizational, community. Okay, that was the first half. Let's move on to the second half. How to actually do it. Okay, so more about terms, not so much about steps. But you want to get specific, usable, actionable steps, then go take a public health class. Evidence-based, you hear that all the time. Now we don't say somebody should do something because it sounds right. Okay? Because time and time again, that advice was given in the old days and it turned out to be wrong. Because in theory it sounded good, but when it finally was applied in practice, it turned out there was a little detail we didn't take into account, and it had a negative effect. It was regrettable. So we don't do that anymore. We have to prove that it works with evidence. Sometimes the evidence is not available, but you still got to do something. So evidence is, the only way to get evidence, by the way, is scientific experiments. But sometimes scientific experiments is not an option. It's either impractical, it's too expensive to do, it is unethical to do. In order to do a proper science research experiment, you have to isolate variables, and sometimes in order to do that, somebody has to be actually harmed, which is illegal. It's immoral, unethical, illegal. So it's just not possible. Sometimes it's just too damn expensive. So the evidence from science experiments, just not an option. Then the only way you can get any kind of data is through observation. And remember last week the difference between an experimental study and an observational study. Observational, you cannot prove anything. You can only show that there is an association, a correlation. But that's something. And at the very least, the lack of an association, a lack of a correlation is relevant. At least you show that there is no link there by showing negative association, or lack of one, I mean, not negative, but lack of one. So that observational study in this way has a different name called the socio-ecological approach. So instead of capturing, let's take like a tribe of monkeys. Instead of capturing the tribe, putting them in cages, sticking them with needles, and doing a scientific experiment, instead you leave them alone. Like Jane, who's that lady who watched those monkeys, or apes? It was apes. And observed them for decades and got famous for doing that. Or I guess by your generation, you don't hear about her anymore. There was a lady who sat and watched chimpanzees, I believe, and just watched, didn't interfere. I mean, they could see her, but she was around for so long, they got used to having her around, and she just became part of the background. And so they started ignoring her and acting naturally. And so she made these observations. Nothing can be proven because it's an observational study, but she watched them function in society, in their society, in this ecosystem. So that's the socio-ecological approach. What does that mean for human public health? Literally sit there and watch people be people. Go sit a little out of the way at the cafeteria and just watch Queensborough College students come and go, interact, and start making like anthropological theories about it. But this time, since it's a public health effort, then you want to see how health behavioral choices are made at the checkout line, in the food choices, what people bring from home, and that's just pure observation. That's a socio-ecological approach. It's best to do a science experiment, experimental science for evidence, but sometimes it's not practical, unaffordable, or unethical. So instead, just sit back and watch. So that's what this is about. Okay. Oh, here. So another big difference this time is in a science experiment, you focus on one and only one variable, and you try to lock down all the other things that could be different and keep them exactly the same between the two groups. In a socio-ecological approach, you look at all the variables, as many as possible, and so the entire cafeteria as a whole, and make observations as a whole. You can imagine now why that would really lead to not being able to prove anything, because there are so many cross interactions. There's really no way to prove anything. But at least you have a chance to show whether there is a association or correlation between this and that, or if there is none. And then there are at least you prove that those two are not related. If you told Americans to stop eating ice cream in the summer, or that's your project, I'm going to tell New Yorkers to stop eating ice cream from now on, how far would you get? How successful do you think you would be? Absolutely zero. You would have zero chance of that ever happening. The community, New York City, has zero capacity to give up something that tastes that good. So there's no chance. Community capacity is how much the community might be able to handle that change, accept it or believe it, like that. Empowerment is the will and ability to change. Grassroots is if the incentive for change came from the people themselves, not from top down. So this is the absolute opposite of top down. Top down is somebody shows up in a community and says, I'm from headquarters, or I'm from the government, and I know how to fix your problem. That's top down. Grassroots is bottom up. The community decides we've got a problem and we're going to fix it. Social capital. Okay, the word capital, think of it as wealth. And in the financial system, financial circles, capital is wealth. It is money. So the thing about money is you can use it like a tool, and it has all of the attributes of using a tool in the financial system. So now if you want a community to change, then think of it as tools to make the resources to make the community change their behavior. You want them to stop eating trans fats. You want them to exercise more. You first figure out how much exercise they can tolerate before they kick you out of the city. They run you out of town. And then you got to convince the community to finally believe you and to start exercising more. But how do you do that? Well, for example, when you first meet somebody, like one of the gatekeepers, one of the community leaders, like they've never met you before, So at the very beginning, you have a little bit of benefit of the doubt. You seem to be a nice person. You seem pretty clever. You have some good letters of recommendation. So the community leader says, all right, I'll hear you out. So there, you got a little bit of social capital. And now you have to use it wisely. Like you got $5. You showed up in town with $5. You got to use it carefully. You can't spend it all in one place. You can't waste it away. Instead, you have to invest it very wisely to increase the social capital. If you say something that turns out to be an absolute lie, there, you wasted that social capital. So you want to, if you say things that increase trust, the community leader, you do things and say things that makes that community leader trust you more, believe you more, see your way more, and they're just increasing their confidence in you. That's building social capital. So social capital is like that thing you keep in the bank. The more you are getting on the good side of the people in the community, the more social capital you're building. And every time something goes wrong, every time you cause dissatisfaction or suspicion, then you're spending social capital. So finally you have enough to say, okay, now we have to do that. And then the people say, I don't want to do that. You have to exercise more. I don't want to exercise more, but it's good for you. So what? I don't care. Look, believe me, you got to do this. Everybody has to walk 5 miles a day. Believe me, do it. If you have enough social capital built up, they will believe you and do it. If you have very little, they'll say, go F yourself. I'm busy. So that's what social capital is. 100 years ago, when this community building science and skills were being first thought of, people mostly lived in small towns. Everybody knew each other. Families were large and extended. But since then, the majority of the population has moved to cities where it's people lived in just nuclear families, parents and kids. That's it. And nowadays, people they just have one kid. The reproduction replacement rate is shrinking, so it's less than 2 per household now. So the families are shrunk very tiny, and larger and larger percentage of the population are not even married. They're living individual lives, so they are literally lonely in a busy city. So the community is much harder to build because people just don't have a reason to go out and interact, especially now that everybody's on their phone. And so their chosen community is not the neighbors, it's the people who share their interests on whatever social media they're following. So it's harder to build a local, physically, geographically local community effort, but it's kind of being substituted for online community efforts. So public health efforts are spending more and more resources on improving health, behavior changes towards health on social media communities. I just finished my own individual training on this online course about the infodemic, so information epidemic. It's fake news out there, like people telling each other to get a sunburn to cure acne, and that is just like people being complete idiots. But there is another kind of fake news where people intentionally convince people into believing the wrong things to make money for power, prestige, and profit. So they know they're saying things that are wrong or harmful. They don't care as long as enough people believe it and give them money, vote for the people they want to vote for, or give them the most likes and subs. And so that's another thing. The WHO is recognizing that the internet itself is like an ecosystem, that ideas are bouncing around this ecosystem like a virus. So they're using strategies of handling viruses in living communities and adapting them to handling memes and fake news in electronic communities. So they're recognizing that the electronic space are communities in themselves. 7 assumptions of community building. Some things that you want to see in a community before you even try. That's what I'm saying. So you know it's not upfront a waste of everybody's time and budget. And these are the 7 things. You want to see a community that is capable of these 7 things, and then you can try. One of the takeaways from this infodemic course is your efforts to correct fake news out there should not be directed to the people sending out the fake news. Don't try to change the mind of somebody who is deep into the conspiracy theory. You are wasting your time. Instead, address the fake news items among the people whose minds can be changed, the audience to that conspiracy theorist. So don't change the conspiracy theorist's mind. Focus on convincing the people who are listening to that guy that that guy should not be listened to. And then use your evidence, use your facts, use your reasoning ability on these people so they don't end up being caught in that trap eventually, for example. Okay, so that's that. And you notice I didn't address any one of these individually because you can read these for yourself. I'm just telling you it's there. Okay, organization methods. I'm not going to talk about specific steps. We just don't have that kind of time. But they are out there, and there are different kinds of organizing methods, different theories about how to properly organize a community. But anyway, here are some large, high-level ideas. Okay, the initial organizer is the one who first starts the project, and that could be grassroots, right? Okay. In order to change the minds of the people in the community, you have to understand the people in the community. You can't just dictate to them. As somebody once said, you have 2 ears and 1 mouth, so you should listen twice as much as you talk. In fact, the first time you're there, the first phase of community change is listening, not talking. You go into a community and you listen. What is it that they find important? What are their priorities? What is it that they're annoyed about? What is it they care about? So figure out what's going on. Don't assume you know. Ask. Talk to them and listen. A great place to start is the gatekeepers, the people in charge of the resources in the community. When you finally have enough of a large enough staff, then you can start forming them into subgroups, like a task force. A task force is a temporary group among your own people. A coalition is when some of your people interact with some people from another organization, so the two of you can work together. Primary, secondary building blocks. The resources then can be thought of as blocks, like you assemble blocks together to make a castle, etc. Primary blocks are the things you control. Secondary blocks are the things you don't control. So you have to ask permission. You have to pay for it with social capital or actual cash. You have to convince the people in charge of those blocks to see things your way and to join in your organization or join a coalition. But that's the difference. Primary, you control. Secondary, you don't control. But these are both in the community. Potential blocks are those that are not yet in the community, but could be brought in. And that means either you have to convince the people who are in charge of that to bring it in, make it worth their while, to pay for it if you have to. Okay, one of your homework assignments then is after you figured out what the problem is, you know what the people care about and what their capacity for change is, You have a beginning staff, you have the beginnings of an organization, and now you have an idea of where you want the community to be, and now you need to know where they are now so that you can figure out how much travel there needs to be done. You know your community, you want your community to have like this much more exercise at the end of 10 years. It's time to figure out how much do they really exercise now, so you know how much more exercise they need to do over the next 10 years. So that is a needs assessment. A needs assessment is figuring out what is the state of the community now, and specifically what is the state of the project now. How many more resources do you need? How many more people do you need? What's already being done so you don't have to repeat the work? That is a needs assessment. And it gets way more detailed than this oversimplified slide, right? But since you have never taken a public health class, I'm not expecting you to generate a professional level, full-blown needs assessment. Instead, just answer these things. Your homework will basically be pick a community, your choice, pick a problem, your choice, and then answer these questions that you know about this choice, and then answer these questions to form a needs assessment. The difference between goals and objectives. Goal is a far away direction that you want to eventually go. I want to end world hunger. You will never end world hunger. That is absolutely impossible. But it is an awesome goal to work towards. It's definitely something worth doing. Trying to end world hunger. Just be aware that you will never get there. However, you can work on the objectives, and objectives are steps towards that goal that you can achieve. That's the difference. Objectives are things that you can achieve. You can reduce hunger by a certain percent. That's an objective. You just never will end hunger. So that's being specific. A certain percent by a certain time that is realistic, but not just realistic, that you can achieve, and it is specific. And this is the SMART. Whenever I ask you to say something specific in a homework assignment from now on, I'm expecting you to spell out the SMART for that thing. You need to answer each one of these for that thing you're being specific of. Okay. Contingency plans. No plan, so the military phrase is no plan survives first contact with the enemy. They can have volumes, an army can have volumes and volumes of plans of what's going to happen in the battle, but as soon as the battle begins, all those plans get thrown out the window and they just work with what's going on. That's called being flexible. And so you have a plan. It's good to have plans so you can organize your budget, organize your resources, but be ready for reality to hit and completely throw your plan out the window, which means you have to have backup plans, and that's what a contingency plan is. It's a backup plan. So you got it. You've got the implementation, and then you have a plan, and then you put in action. So now it's time to figure out, to see how did it go. Then what you do is you get the results, you track what's going on as they happen, and you have a look at it and decide, is it good enough? Is it what you expect? Are you exceeding your expectations? Or are you not meeting your expectations? Or is everything going to hell because your base understanding of the community of the problem was completely off track, and now everything is just worse than it was before? So that's called evaluating. Maintaining then is adjust the plan to the new information, and then you repeat, rinse and repeat. So that's the looping. Promotion is a fancy word for advertising. Like you show up at a supermarket and the announcement says, "Dear shoppers, we have a new promotion, half off, whatever, half off avocados." So then you go, "Oh my God, avocados are so expensive. If they're at a discount today, I'm going to buy as many." So that's a promotion, advertising, and you want to, and promotion is absolutely part of your project because you have to convince the community people to believe you. So posters, pamphlets, commercials, social media now, you absolutely must have a social media manager on your staff. So this is all part of your project and your project team. Validating, fancy word, meaning that you have some, were the numbers you started with accurate? Were the numbers you started with you assumed were true? Did they turn out to be true? And that's validating. Intervening is, oh, well, you already know what this means, right? There was a TV show, Interventions, like people who are hoarders, and the TV crew came in and somebody cleaned out their apartment. That's intervention. Somebody is being in some self-destructive behavior, so the intervention was to make them stop. So if a community is being hurt by some healthcare crisis, then the intervention is to do what they need to reduce that crisis. There was a phrase, the dose-response relationship. The more you do something, the more effect you have, and that's the dose. So you're used to seeing the word dose as in the amount of medication to give, but since it's a health project, then the dose of the project is how much of the project you're going to do on the community. Like how much of an effort you're going to make, that's dose. I think the rest is self-explanatory. This is what I've been looking for. The pilot test. You have $10 million and 2 years for your project. You have an initial plan. You have a theory. I think this is the way we're going to do it. Do you blow all $10 million on this theory and hope everything works and cross your fingers? No. It's best if you pick a small part of the community and try it out there first. When you're using a new detergent on like a new kind of fabric, it always says try it on a corner of the fabric first before you throw the whole thing in the washer and dump in the detergent, right? So always try it on a small part first, see how it goes. That's the pilot project. So you don't risk your entire budget, your entire schedule, and then find out, oops, I made a mistake on an assumption, I wish I could do it over again. No, you don't get a second try, you only got that one budget. So try it on a small thing, and then if it works, try it on a larger area of the community, and then if that works, try it on a larger area, and guess what? Probably it'll never work the way you thought. So you try it on a small pilot, you see the mistakes you made, adjust, try it on a larger project, you learn the mistakes you made on that, adjust, and then expand out until finally you're ready to fully roll out the whole project into the whole community. And then I'll finish with this definition here, formative versus summative evaluations. Formative, like when things are taking shape, being formed. So these are evaluations you do as the project is ongoing to see if there are any adjustments you want to make ongoing. Summative is what you do after it's all done and over. Did you have the intended effects you wanted? Did exercise increase throughout? Did everybody exercise 10% more because of your project was so phenomenally successful or not? One example is this class. I'm teaching, you're sitting there politely silent. I have no idea if my words are reaching you, if you're even paying attention. So how do I know if I'm being a good teacher? Well, I wait for feedback, but nobody has sent me an email yet saying you don't understand. So what I do is formative evaluations, homework assignments, quizzes, and midterm exams to see if what I said stuck in your head. If you did good, that means I'm doing good. If you scored high, it means I'm doing good. If you scored low, it means I need to change something. And then finally, the final exam is the summative evaluation. Did you get out of this course what I hoped you got? I will know because of the scores you get on the final exam. So that's the difference. Formative is like quizzes and homeworks. Summative is the final exam. So the final slides are like elaboration of it, and the last slide is how the CDC does it. This is their page of how to organize a community. So it's everything I just said, but rearranged in a certain way by their authors. So if you wanted more details, like how to do it, then you can go to this link. Anyway, that's it. Thank you for your patience. I wish you luck and success, and I'll stop the recording.